Okay, so Dr. Root, can you just introduce yourself and let us know when you arrived on the island, what you do for the veterans?
Sure. My name is Dr. Lisa Root, and I'm a trauma specialist. I arrived here in 2021, and I have a private practice called Solomon's Porch. It's definitely Christ-based, which is part of my culture, and I serve 98% of my practice is vets that have PTSD or major trauma. And I do this, 6 days a week. And I'm located at the Westin in the back behind the Bon Voyage. And you could just call my office and make an appointment.
What's the number to your office? Are you on Facebook?
Yeah, I'm on Facebook, and you can call Solomon's Porch.
Mm-hmm.
And my secretary has all the information. I didn't bring anything with me into the office here tonight, so sorry about that. Oh,
No worries.
wait, hold on a second. So the cell number is 671-688-7668. And the telephone in office is 671-989-4325. We will get you in as soon as possible.
And you see majority of your patients are veterans?
Yes.
All right. And let's ask the question, I guess. If a veteran wanted to come see you, what is it that they have to do, or what are they required to have before they can see you?
Actually, the best thing to do is call community support, community care.
Okay.
All they have to do is ask for me.
Okay.
Or they can get a referral from somebody like Dr. Akoma or some of the other docs that I serve.
Okay.
And they can give them a referral from the VA to come into my office. But Community Care Network is who bridges us
Right. Okay.
in here and in Hawaii.
Okay.
That's all they have to do.
Do you do any telehealth?
I do, yes.
Is that what they call it?
Yes.
Okay.
They do. And so you can see me on computer, or some people are a little shy, and so we'll talk on the phone. But my Fridays, I serve a population both in Alaska and in Guam because I have two practices. And so there's a lot of people who choose to do that, and we're okay with that.
And I believe the veterans are actually trying to be indoctrinated into the more of being online and using the virtual type of setups. How have you seen that as far as, like, is that something that our veterans are very, do they gravitate towards that more so than face-to-face?
I have both,
Okay.
but anybody who doesn't have the skill set to go online, my secretary and my staff will help them
Oh, I see.
to get online so that they can see me. You bring your computer in, my staff will help them set it up.
That's really nice.
And so it's like a no conflict area for them.
All right. Now, the folks up at our CBOC, right? It's Dr. McDermott up there. And then for me, I have Dr. Boonpane. I hope I'm not butchering her name, but she's my primary care. And these are the folks that I believe the way the system works today is if I wanted to go or come see you, I would need to request that from my primary care provider or doctor, right? And sometimes these terminologies can be a little, difficult to understand, especially for some veterans who are just, hey, I just want to go get seen by a doctor. It's,
Right.
Doctor is a doctor for some of us, but I think it used to be self-referral a couple of years ago, but today the primary care doctor or provider must authorize it.
Right, and our CBOC is terrific. They're
Yes.
a wonderful group of individuals. They will help our vets to the nth degree. They will help them not only get a referral, but they will help facilitate how and what to do, and they will also connect with the VA itself. So I don't work for the VA, but I'm a provider for the VA.
Okay.
The same with CBOC. CBOC are providers, and we're kind of umbrellaed under. But we all work very intricately with one another. They're a great group of people to work with at CBOC. And so I just would encourage our vets to go in and get seen by anybody who's available, and they'll get them to me with a referral with no problem.
Awesome. Now, would you say that we may need a few more psychologists or mental health professionals for our veterans out here?
I think we have a lot of mental health providers. We don't necessarily have a lot of trauma specialists.
Oh,
And so I specialize in trauma. When I take my CEUs,
okay.
Continuing education classes,
Yes.
I take, the majority of them are on in trauma,
Okay.
purposefully.
Ah, okay.
Because there's a large difference between like a residual trauma
Okay.
and then complex trauma.
I see.
But we have a great island with wonderful mental health providers.
Okay. And you are aware that we have the highest per capita veterans to population in the United States. So in essence, we're the most patriotic place in the United States.
Yes. We also, I know we're working diligently on trying to get a branch of a hospital here so our vets don't have to go to Hawaii or another place. But, like at everything else, it takes a lot of finances and government backing. I know we have
Yes.
a wonderful governor. I know she's pro military, pro vets.
Yes.
We appreciate her and all that she does for our island, and I know she's working diligently behind the scenes to help our vets.
Of course, and we also have with the build up, right? We have all they call it the tip of the spear, and there's a large number of Marines and other supporting casts, and then family members that are going to be coming out here to the island, and that all that does is it increases the need for more of your services. I'm understanding that the active duty side, right? I think there's a clinic in Anderson. There's a clinic down at Big Navy, and I believe they're going to have a clinic at Camp Blas where where the Marines are. Is that correct, or do you know anything about that?
Yes, so there, a lot of the general population doesn't understand that whether a vet is active or they're retired,
Okay.
their families are entitled to services.
Oh,
So just depending on, like we use CHAMP's program for service members, family members.
active duty, right?
duties,
Okay.
Right. And so, but in my office, I see families of active or retired. Now,
Okay.
I'm not sure what happens outside,
right.
in other clinics, but I see both.
Oh, okay, and you accept
My
them.
office, yeah.
Now, I think when it comes to so on the retiree side and the active duty side, I believe they fall under TRICARE. Now, on the retiree side, they're also veterans, so they might be entitled to some VA medical care.
Correct.
So I think that's a little bit different than a veteran who's not retired. So a veteran who's not retired can avail of the services, but I think if I remember correctly, it's called CHAMP VA, and that's similar to what like the dependents would get on the retiree side and on the active duty side.
Correct, and they still have to go through the same process.
Okay.
They have to go through the Veterans Association. The CHAMP program is a totally different entity.
Okay.
But all you need to do is call, the general VA number in Hawaii, and they will get you to where you need to go.
Okay.
The vet doesn't have to, or the
Dependent.
family dependent doesn't have to worry about that. They will help you facilitate it.
And then you're saying that even in your office, your staff will also take care of trying to help facilitate that for them as well.
Yes, we have the numbers. They're posted on our wall. My girls, I have 2 staff members, and they will definitely help in any way they can. They will call on your behalf and help you get set up for sure.
When I was down at the Agana Shopping Center 2-3 Saturdays ago when the Hawaii folks were in town, the healthcare side, I was speaking to, I want to say Dr. Castro up there. That's the psychologist, correct?
Dr. Castro?
Okay, so she was telling me that she has this new program where I think it's kind of like they're trying to initiate the veterans into kind of getting into wanting to come and understand how it is that the services work for the mental health side. Is that something that you've heard of or you're familiar with?
I wasn't at that particular forum, but I know the community college here has put on some forums trying to help veterans to understand the process, understand what trauma is.
Okay.
What does it look like? What are some of the side effects or some of the symptoms of trauma? Oftentimes people are resistant because people don't want to label. But the services are there, and we are doing our best as a mental health community to help our vets get as much service as we can possibly get for them.
Okay. And when you say resistant, right, I mean, I think sometimes it takes like we got to get our buddies to kind of meet up with their friends and, spend time and explain to them what they've been through and help them to understand what might be going on. Now, in your practice, when you are onboarding new veterans, for example, do you have like a process where you kind of like get to know the veteran first, and then it's almost like introducing each other to one another?
Yeah, there's a lot of different ways we can do that, but a lot of times I will get referrals from docs in our community.
Okay.
And so they come in already pre-diagnosed, but I'm always going to do a solid diagnosis. So I start out using my DSM-5, and I have them go through this checklist, circling every symptom that they have, and we sit down and we talk about what do those symptoms look like. And the very first one is their trauma. And so we're not in any hurry. We take it very one moment at a time.
Okay.
And we don't rush anyone through anything because they have to retell their story. And the most important thing to me is their story.
Oh, wow, that's great. And we work with a lot of veterans, and we find that sometimes these veterans might not have a specific like trauma where there's combat involved or assault or any of these your run-of-the-mill traumas. We've talked to some of them that have, for example, musculoskeletal conditions that are very, very debilitating for them. And these conditions tend to affect them mentally. Is there a certain like diagnosis that might fall under as it relates to like, I think it used to be called chronic pain, and I think they sometimes call it somatic symptom disorder. Is that something that falls into your realm?
Mm-hmm. So, my office, we deal with all kinds of symptomology, right? But it's just like any, like let's say firefighters or police officers, any time that they are out on scene and they have a tremendous accident that they're covering,
Exposed,
right?
yeah.
Right. So, do they all have PTSD? Not necessarily.
Right.
But they have a place that they can come to, and we can walk through what they've seen, what they've experienced, and we can calm some of that down so that they're not traumatized when they're on the job.
Okay. So if I'm hearing you correctly, it's important to have like early intervention. Maybe does that sound correct?
Correct,
Okay.
correct.
And have that available so that in the event they might have triggers, or the event starts to I think there's like flashbacks or intrusive thoughts of
Right.
that event. They're already being cared for, and it helps them to
Right.
cope a little bit more.
Right, and so you have an incident that occurs, and then all of a sudden they're having nightmares, or they're having irritability,
Right. Yes.
or some depression, or some anxiety, right? Well, I'm not going to necessarily classify. Of course, I'd look at my DSM, but I'm not going to say this person has PTSD. I'm going to say this person is having these symptoms,
I see.
and we're going to work through them.
Okay.
And we're going to deal with them. And, like I do back in a different state in Alaska, I do like 5 cities worth of police evaluations. So
Okay.
they go through the psychological evaluation with me in person, right? And then I think that fit for duty is what we call that, a fit for duty. But I really think that responders should have that opportunity to go through a fit for duty before they're placed back into the environment again, because they might want that opportunity
I see.
and it may not be present for them.
Oh, okay.
And they're just put right back in the field. But the officers that I talk to are grateful for that fit for duty
Interesting.
because they want to process everything that happened. It's not saying they're not fit for duty. It's simply saying, I just want to process what I've seen, what I've handled, know I'm good to go, know I'm ready to be back into the field.
Wow, that's interesting. And I guess it's not as cut and dry as everybody thinks, right? It's it has a lot of parts to it, moving parts, and I guess not everybody's the same when they also are exposed to the different traumas. Two different people, one may be more traumatized than the other, or the other two.
True, and it also has to do with their schema, what's happened before, prior in their life,
Oh,
compared to just the incident in the moment,
I see.
and how they've processed that previously.
So that's why not everybody's going to have the same outcome based on the exposure.
Exactly.
Okay, so I know that one of the things that the folks that are in, so they have the CMP examiners come out here, and one of the questions they ask them is, did you ever get spanked when you were a little kid? And that kind of, for some of the veterans out here, right, if you look at the backgrounds for some of them, right, I mean, discipline was done differently, and I think the same stateside, right, I think it's a little less, it's more frowned upon now, and they have different ways to, instill discipline as opposed to, spanking, and those types of things change a little bit. So.
Yeah, and generations too. My parents' generation, it was, there's a scripture that says, spare the rod, spoil the child, right?
Yes.
So my dad is definitely going to raise us spanking us, right? I mean, that's his generation
Right.
versus the generations now.
Right.
But that doesn't mean that just because we were spanked, we come out with trauma.
Yeah, okay.
Right. We
Very
don't.
good. And one of the reasons I bring that up is what we're finding with some of the CMP exams that come out, right, is they would automatically push the trauma or the symptoms to their childhood as opposed to what may have gone on in service. And as you know, if that starts happening, it pulls away from service connection. And I think sometimes our veterans kind of want to get an understanding of what that means. It doesn't mean no. It just means when you present it to the CMP examiner, they're going to have to take it and use it. So there must be an explanation as to where that should go or how they should maybe explain so that it's differentiated.
We're gonna we're gonna take a break in a few seconds. So you're watching the Veterans Talk Show, Veterans Benefits, on 93.3 FM KUSG on The Point on Facebook. We'll be right back.
Today, this is Michelle from APL Guam. Here at APL, our expertise and extensive network can help you grow your business and reach out to more markets. As a responsible carrier, APL is also committed to a sustainable future, whether it's protecting the environment or investing our efforts in giving back to the community. Our dedicated teams in Guam and on the U.S. mainland are here to support you. Call 588-4651 or visit apl.com.
Hi, this is Jerry Roberts. What's happening in the workplace? What about your job and career? What ideas will find their way into your world? That's what you get with The Extra Point every day on The Ray Gibson Show here on 93.3 FM. Sometimes it's about what's in the news, or working relationships, or how to get further and do better. I try to make it interesting, inspiring, and hopefully sneak a little fun in too. Be a part of it. 7:25 weekday mornings. The Extra Point. Brought to you by First Hawaiian Bank.
Take a pause.
Super Bowl stars are going to be staying in the Lake Las Vegas Village in Henderson, Nevada ahead of the game. But at least 4 people there have been bitten by coyotes in the last 3 months. And it's because someone's been attracting the animals by feeding them. Animal Control Administrator Danielle Harney.
These are wild animals, and when they're used to getting fed and not getting what they want, they will bite people.
One woman caught on video feeding donuts to the coyotes. So the coyotes assume other people are going to have more goodies. State wildlife officials say 10 coyotes have been euthanized already after they were coming into the village for food. The big concern? Rabies.
It is a almost 100% fatal disease in people when they don't have the vaccine and aren't treated right away from a positive exposure.
As for the football players, maybe you want to just leave the padding on at all times. Take a pause. Jill Nato, Fox News.
And we're back. Hello. So in studio we have Dr. Root, but before we get back to Dr. Root, we are going to announce the Veteran of the Week. So Veteran of the Week is Benny C. Rosalind. He knows this because I called him today. So a little bit about Benny. He was a high voltage electrician. He began his career as a wireman lineman with the Army 7th Signal Brigade in Germany. He later served as an administrative and personnel clerk with the 3rd Marines 1st Marine Brigade. From 1978 to 1980, he worked for PwC as a warehouseman, then joined the apprenticeship program. Upon discharge from active duty military, Benny Rosalind enlisted to Company D in the Guam Army Reserve 411th Engineer Battalion, Navy Station, Guam in 1977 as a construction specialist. He attended the following military schools. This is a lot, Benny. Basic Special Training School Battalion, Camp Pendleton, California. Brigade Leadership School, Army Southeastern Signal School, and Army Communications Special School. Some of the schools attended University of Maryland, University of Guam, Central Texas College, and Guam Community College. He's a graduate from the apprenticeship program of high voltage electrician from the U.S. Navy. He's worked for Department of Mental Health and Substance Abuse. He's worked for Guam Power Authority, Department of Public Works, coordinator of highways, transportation, building maintenance, solid waste management, and bus operation. Currently, he works at Adelup, and he assists veterans because he is also a veteran, and he assists veterans with their process. He explains it, and he also refers them to HMI, to the office in Teason and the office in Aston. Thank you, Benny, for your service.
Congratulations.
Yay. So I did want to ask Dr. Root a question. So I know we talked about this during the break. So we have veterans going to their CMP exams. What would you tell a veteran that's listening about the exam or how to answer the questions? Because some of them are nervous going into these mental health exams.
Sure. Honestly, the best thing to do is to be forthright and straightforward about every symptom that you're experiencing, even if you don't think it's significant. It is significant. We want to know. I don't do CNPs. I have colleagues that do CNPs. In my office, I do have a questionnaire, actually, which will help your doc to write the verbiage necessary with the nexus so that it will state specifically this was in service connected and the reason why it was in service connected. That's really important. And it's important because the Veterans Association wants to know when, why, how, where this happened so that we can get you the benefits that you need, not to withhold benefits from you. And anybody can stop by my office. We have this literature available because we love you guys and we want you to get the service connected rating that you deserve. Okay, and the verbiage is very, very, very important. But the literature is free. It's in my office. We make copies all the time to help docs, as well as to help service members to show them how to show their docs why this injury is service connected. But when you're honest with your doc about where this happened, when it happened, what happened, they can help connect that for you as well, so you get a good rating.
And Dr. Root, that doesn't always happen on your first sitting.
No.
Yeah, it takes a little time, doesn't it? So it's important for our veterans to make some time and come out and, see their mental health provider and hopefully they're like you, or it's you that's taking care of them because, you're someone that can explain to them what's going on, because it's a tough enough battle to try and go after your claims in the VA system. But you're absolutely right. The VA wants to give this to our veterans, but it's up to our veterans to tell the VA why it is that they're entitled to that. So I hear you loud and clear, and that's really, really nice that you do that for our veterans.
And I want to piggyback a little bit off of that. When you come into like my office and you see me for the first time, you're not necessarily going to tell me your whole story the very first time. You're getting to know me. Yes. You're getting to, feel me out, feel my personality out.
And build the trust.
Exactly. Build
even
trust.
The environment, right? The office, maybe it's not comfortable for you for whatever reason.
And so I do have members. We've gone down to the beach and we've sat on the beach. We've gone out to different tables outside. Let's say they smoke and there's an area that they can smoke in. And my office has made the way for vets to bring their service animals also.
Oh.
And that's really important to me because that's an extension of who they are. And I have people who bring their service animals in. And if they're not comfortable sitting inside, we'll go outside. We'll go down by the beach. We'll do whatever it takes to help that member feel safe during that time with me.
Awesome. And I know you might have mentioned just briefly that there are some programs that are a little bit different from what goes on inside of like a clinic, right? You talk about going outside to a bench or down at the beach, and those are things that help the veteran be comfortable and kind of express themselves a little bit more. So it seems like just sitting in an office and on a couch like your typical what you see on TV is really not the new way to do this.
No, and matter of fact, there are psychologists out now, trauma specialists that I study under. They're actually promoting doing physical exercise with their people, like going for a walk.
I see.
Or getting in the pool and doing therapy in a different setting than just the clinical setting. Partly because we know that when we have trauma, our brain operates in, and I don't want to get into all of that, but in different capacity. But if we can engage physically as well as just the emotional aspect, the fight, flight, or freeze with the amygdala, we can heal trauma at a greater capacity. So we're opening many parts of the brain.
Wow, so this seems
heal.
This seems like it's even getting more involved, and it seems like they're doing this probably because it helps a little bit more. Does that make sense? Or
Absolutely, and it's not only. I mean, like it's worldwide. Some of the people that I study under, some trauma specialists, they're doing this and have been doing this for over 10 years, and engaging the physical body.
So a good 10 years ago, there was, if my understanding is correct, the way they want to approach treating patients in your field is partly the therapy and I think some medication. How has that changed today from 10 years ago?
I think that actually we try. I mean, talk therapy, of course, has been around forever,
Yes.
right? But I guess there's a couple of philosophies out there. I tend to be more homeopathic, natural, holistic, right? And I think most of the docs that my veterans serve, we kind of are all on the same page. We are going to use less medication versus more medication. Now, I am all for medication that works. Like, for instance, if I have a soldier that's having a night terrors and he needs medication for sleep, we want him to be on medication for sleep because sleep affects our entire body. It affects our attitude, it affects our work, it affects our behavior, right?
Right.
So, but I think a lot of our docs out there now are choosing to use less meds and get them into more clinical help than to just massively medicate.
And the medications that I'm more familiar with they're the types that you have to get on and kind of gradually take them until your mind gets used to it. And then you got to stay on it for a little while. And then after that, you got to wean yourself off of it as well. And those are, I don't believe there's any medication that they can come to you and say, Doc, I just want to feel good for just today, and after that, I should be fine.
No, and because I'm not an MD, I don't write scripts. But I do know the physicians that I work pretty closely with. They are going to titrate them on a very slow increment.
I see.
Until they get to what we call a therapeutic level. And when they reach that therapeutic level, they're not going to increase that dosage. They're going to find out how that dose is working for them. I'm always checking in with my patients all the time on their medication. If I think that there's a problem, I'm going to say, I want you to go back to your doc and I want you to talk about this or this or this. Are you having problems with right now? Because I don't prescribe,
Right.
I can't dictate to the doctor and I wouldn't. But I can maintain. I can look at them and say, okay, you told me you haven't slept for the last 2 weeks, so I need you to go see your doc. And we've got to talk about your sleep patterns, right?
And so when you're talking to these doctors, could a family practice doctor be the one prescribing the medications for mental health?
Absolutely. I
Okay.
mean, we have some great family practitioners on the island. Most of our docs on the island are just fantastic. They listen.
Okay.
They listen to our vets. They call me a lot of times. And they don't have to be particular in one area or another. You know, it just depends on why they're being seen, their patients being seen, right?
Now, in medical school, do family practice doctors dabble a little bit in the mental health side?
Yes.
I think that's part of their prerequisites. Is it correct?
Most physicians will have some mental health training.
And they're not the experts, but and the good ones would be able to seek other like getting them to a psychologist or refer them out to somebody in that field, right?
Right, and so there's a difference between a mental health provider or a doctor of psychology like myself,
Okay.
or somebody who's a psychiatrist.
Psychiatrist, yes.
A psychiatrist is going to have the expertise in the field with medicine.
Yes.
For me, as a doctor of psychology, I don't write prescriptions,
Okay.
but I do monitor and I pay very, very close attention so that I understand exactly what this person's taking, so that if I see behavior patterns that are outside the norm, I can talk to him or that individual. I can let the family know something's off here. We really got to deal with this. Will you please call one of our docs? Because we're a team of people that work together, family and the providers.
Yes. Now, why would I know that a psychiatrist prescribes medication and also does the specialty of mental health, and then there's a psychologist like yourself, and then you would need like a family practice doctor to prescribe medication. So those seem to be like two different avenues. Could you explain why it would start off maybe at family practice rather than going straight to a psychiatrist, for example?
Sure. Let's see. Let's say you went in and you had the flu.
Right.
Okay? And then your great family practice person notices that you've been having issues with sleep. Or the wife says, we're having a lot of flashbacks
Right.
from trauma.
Okay.
That then, more than likely, the family practice person would refer out
Okay.
to like a psychiatrist.
Right.
That family practice provider may or may not address the symptoms because they want
Somebody.
an expert
Yes.
in that area of trauma to deal with some residual effects. I get people into my office as a licensed professional counselor. I get people into my office because I've specialized in trauma.
I see.
And so most of my study, not all of my study, I do family, I do all kinds of stuff, but the majority of my continuing education classes are always geared towards, most of them are geared towards one form of trauma or another. And that's just because I specialize in that.
Thank you, Dr. We're going to take a break real quick. Once again, you're listening to 93.3 FM, KUSG on The Point. We'll be right back.
KFC's Lent menu is filled with so many seafood options, it's enough to keep you going for the entire Lenten season. They're all here. Popcorn shrimp, fish wraps, fish fillets, shrimp and crab Killiquin wraps, and our famous KFC shrimp burger. And now you can mix and match chicken and fish in both 6 and 12-piece family meals with sides and biscuits. KFC's Lent menu is available for a limited time at all KFC restaurants and for delivery at KFCGuam.com or WhatsApp 300-3278. KFC, it's finger-licking good for Lent.
Yikes, it's February already, and those high-interest credit card bills just keep on rolling in. But then there's our New Year's resolution loan, which, by popular demand, Bank Pacific is extending throughout February. Up to $50,000 at a rate as low as 7.49% APR. Pay off those credit cards or whatever else you desire. Apply online at bankpacific.com or visit any of our convenient offices. Equal credit opportunity lender. Conditions apply. And yes, it's February, but still, Happy New Year from Bank Pacific.
And we're back. So I just wanted to say hello to everyone that's online. Let me see. Hi, Auntie Bennett. I see you. Thank you for watching. Hi, Julie Paris. Oh, you're very welcome. And then Steve says, QTC has a portal that allows veterans access to their scheduled CMP exams. And majority of the time, it has questions that can allow veterans to prepare or fill out the form that will help them with their CMP exams. Then he also sent us a link on honorable discharge benefits upgrade. So yes, you can definitely upgrade. But we also want to thank all the veterans that came out to our fundraiser at Good Times this past Friday.
Yes, it was Friday.
Gosh, I forgot what day it is. And we're also wearing red because Valentine's is on Wednesday.
Yes.
Wednesday, yes. Like I said, I keep forgetting what day it is.
And we want to thank Elevenses for sponsoring us.
11Zs.
11Zs. And thank you, Miss Grace. And if you need any Valentine's arrangements,
preserved roses will last forever.
And by the way, if you need some coffee or some drinks back there,
acai bowls,
you get 11% off as a veteran out there. So
yes.
Make sure you get out there and go see her.
Yes. And you can call in at 888-8255. We are here every Monday, 6 to 7 p.m. You can listen to us on 93.3 FM and on The Point on Facebook. And then, so did you want to talk? Did you have another question for Dr. Root?
Well, maybe let's take her off the hot seat and we'll just let her close up and just give a closing, information about your practice and what you think about our veterans and how you can help them a little bit more.
Sure. Well, I just want to encourage all of our vets out there that we love you and care about you and what happens to you. And so we are in the Westin Hotel. It's 501 Beach Street. And the name of my practice is called Solomon's Porch. It was named after King Solomon. And it is a place of healing and wisdom. And nobody is turned away. Whether you have started the process or if you haven't, you stop in and we'll help. My staff will help you get set up. Community Care Connection is the key to beginning that process. You won't be turned away, and you'll be welcomed with open arms because we are all about serving you.
So that's a good question. So I know a lot of veterans might ask, once we jump off. Hi, Julie. Julie Canata is joining us online. What insurances do you take? I know you said Care in the Community, so that's a veteran that's service connected or has service connection. But what about other insurances? What other insurances do you accept?
I take every insurance on the island, all 5 of the major insurances.
Okay.
And if I don't, I will find you a way, and we'll also try to connect with voucher systems out there. We are not a government-assisted program. Like a mental health facility would be, where they're taking Medicaid, Medicare. I can't do that. I have only the 5 major ones on the island, and of course everything from VA.
So that's Select Care, Take Care,
Stay well.
Stay
Stay
well.
well. Okay. Do you do, what's the other one?
Blue Cross, Blue
Shield.
Shield.
What about Cigna?
Yes, I
Yes,
think we do
yes,
do
Cigna.
Cigna.
And then the referrals from the VA care in the community.
Right. But we take other, a lot of our docs refer to us on the island. So see your general provider, whoever that may be, and they can always call my office and we can help them get connected also through their own general provider to get us a referral.
Okay. And how can they find you? Is it just going to your office in Weston on the first floor?
Right behind.
lobby?
Right behind Bon Voyage.
Okay.
On that store. Or you can call the number that I have on my card.
Okay.
And my secretaries, both of them will answer, and we'll get you in as soon as possible.
Okay.
Our wait list is not extremely long. I know some providers are out 2 and 3 months.
Okay.
We try to get you at least one time into my office within the first 7 to 10 days.
Okay. Wow.
And
that's
we can
pretty
do
good.
telehealth also. So
Okay.
if we can't get you in directly, then we can do the telehealth and then get you automatically on a schedule.
Wow. That's
with
amazing.
us.
That's great news.
Yeah, thank you. And so I know that right now most of our veterans are trying to find a place where they can get all this information all at one place, one location, and with all the different technology out there and the different like social media platforms, it's difficult to say, well, I'll be over here and not over here, and sometimes our veterans might not have a lot of technology as well. So I think we're working on that out here on Guam. It's hopefully something that we can start making better and getting our veterans all tuned in and having that one place to do it. I know that the Vet Talk is up on Wednesdays with Johnny Taitsano, and then we have over at K Stereo and Kish, a veteran that owns that, Mr. Poppy, and his wife and staff have allowed us to have 30-second PSAs to kind of talk about, getting our veterans into what we're doing. And I think earlier I mentioned to you that 2024 is the year of the veteran. So what we're trying to do is find all these things, like your services is going to be very helpful to get all our veterans to know, hey, right now you're hearing it on the radio, and you have, Dr. Root, who's looking to help as many veterans as she can. Of course, we have to find a way to get that done. So we appreciate that.
We have some questions online. Dr. Root, Mr. Roki Cruz says, I'm coming in late on the air. What practice is Dr. Root? Dr. Root is a doctor of what practice?
Solomon's Porch is the name of my practice.
And
I'm
but
a
what
doctor
kind
of psychology.
Oh, psychology. Okay.
And I'm a trauma specialist. So it's a specialty, trauma specialty.
Okay. Call-in number, Mr. Moffness, is 888-8255. And then Mr. Rosalind, the Veteran of the Week, congratulations. He's watching us. He said Vet Talk Show was the most powerful information issues about VA compensation benefits and many programs. Okay, thank you for everyone joining us online. Did you have any last minute questions?
I know we're going to be having a task force meeting Wednesday over at Senator St. Nicholas's office. It's going to be at 10 a.m. The group's going to start talking about what we're expecting as a task force. I think they're going to reach out to more organizations. We know that the commission had just started getting together. Jose San Agustin over at the Asin office started to bring the commission back together. They're going to try to get them going. And I think they'll be having another meeting next month, right? Because they just started this month. Yeah, it'll be next month.
March.
Yeah, and then what else do we got?
And then if you don't know who we are HMI, Ihanana Imagahit Zeni Anina. We hold monthly benefit boot camps for veterans to explain the VA claims process, because it's totally, absolutely in your hands. You can do it yourself. What we do is we just present it in a nice, organized fashion, and everything we do is free. We are a veteran nonprofit organization, and we do accept donations, but everything that HMI does is free. And thank God for this Veteran Talk Show, because a lot of veterans are saying 1 hour is not enough.
Okay. Anything else we got?
So we are meeting in person twice this week. Dr. Coma's office, Hepzibah Clinic, starting at 2 p.m. Wednesday and Saturday. And if you want to reach us, you can message us on Facebook, or you can give me a call, 671-682-7631. I don't say my number out loud. That's funny. 682-7631. And Anthony is 671
688-3607.
Yes.
We also wanted to make sure that we talk about the other members of HMI, which is Jenilyn Paz, John Pangilinan, Virgie Carino, and Tanya Stocchio. So they're part of HMI. Amongst all the other veteran volunteers that we have, many of them just come out and help, and we'll be talking about them a little bit more as the show goes on.
And hopefully bring them on. But I think that's all the time we have.
So
Thank you so much.
thank you for coming, and we'll have you back again if you have some time. And we appreciate all the information you gave us, and I'm sure our veterans did as well. We want to thank our producer, Jose.
Jose, thank you so much.
The
Yes.
Point.
He's in uniform today.
Yes, that's very nice.
Jose, too bad we can't put the camera on you. How do I turn this around? Show them your
The
your
Point
poster.
is KUSG.
Thank you, everyone. See you next week.
93.3 FM
Bye-bye.
and 104.3 HD3.
The Chiefs are Super Bowl victors. I'm Sue Guzman, Fox News. Super Bowl 58 living up to the hype, with the Kansas City Chiefs holding on to their crown in Las Vegas. Fox's Tim McMaster reports.
You can call it a dynasty.
Mahomes flings it. It's there! Hardman! Jackpot! Kansas City!
Courtesy CBS, Patrick Mahomes and the Chiefs do it again, beating the 49ers 25-22 in just the second overtime game in Super Bowl history. Mahomes led Kansas City on a game-tying drive to end regulation, and then the game winner in overtime, connecting with Mecole Hardman from 3 yards out. He completed 34 of 46 passes for 333 yards and 2 scores, collecting his third Super Bowl MVP. It's the Chiefs' third title in 5 years, 2 of them against the Niners. They're the first team to win back-to-back Super Bowls since the Patriots in 2003 and 2004. I'm Tim McMaster, Fox News.
And the hostages in Israel that Israel's been searching for have been